Hi, I'm Dr. Julia Rawlings. In this video, we are going to talk about Osgood Schlatter disease, also known as tibial tubercle apophysitis. Osgood Schlatter disease happens in active growing children, typically between the ages of 8 to 13 for girls and 10 to 15 for boys. It affects up to 1 in 10 adolescents. The patella tendon originates from the inferior pole of the patella and inserts at the tibial tubercle apophysis, a secondary ossification center. In children that are active and growing, repetitive stress at this apophysis can cause inflammation, sclerosis, and sometimes small avulsion fractures. This is most frequently seen in children involved in sports that place repetitive strain at the insertion of the patella tendon with activities such as jumping, squatting, kicking, and running. On history, the patient will report pain and swelling right over the tibial tuberosity. On exam, the tibial tubercle is often prominent with overlying soft tissue swelling. The tibial tubercle will be tender to palpation as well. Other maneuvers that can cause pain include passive knee flexion and resisted knee extension. Checking the flexibility of the hamstring, quadriceps, and hip flexor can also give the clinician an idea of how to guide the patient. Imaging of the knee is not necessary for this diagnosis, but if imaging is obtained, the tibial tubercle often looks quite irregular and bony fragments may be seen. Approximately 90% of patients respond well to conservative treatment, including rest, ice, anti-inflammatory medications, and physical therapy, including stretching and eccentric strengthening. A patella tendon strap placed above the sore tibial tubercle can also be helpful. Pain can be a persistent problem until the growth plates close, so the goal is to decrease symptoms so the pain is manageable and the child can continue to be active.